Hello, John Zamora here, and with my assistant Michelle Rivera. Today, we're going to be talking about one of the skills that you can do as an EMT, which is administering oral glucose. Um, in talking about this, we're going to be going over some of the reasons why you would be administering it, national protocol, going down to local protocol, and things like that. And just some of the other things of like why you would be administering it, what would make you want to, just the process and the steps of when you would do it, what would cause you to do it, and just some of the things that kind of go into that. And like I said, Michelle here is going to be helping me explain some of these concepts and whatnot. So, Michelle, do you have any questions in regards to the concept of what we're going over for our viewers?
Yes. So, what exactly is oral glucose and when is it administered?
That is a great question. Well, oral glucose, to first start off, is basically it's sugar that's in a paste form, and it's administered to patients, obviously through the name orally. So it's basically just a paste-like form of just sugar. And when you would administer it to patients is basically there's a couple things there though. So you would administer it to one patient who is a known diabetic. This is part of like the national protocol. Patients who are known diabetics, and also two patients who are presenting as hypoglycemic, meaning that they have low blood sugar. Once these two things are confirmed, then you have the okay under a medical direction, meaning that you either have some areas would be standing protocol or standing orders, other places it just depends on where you're working at locally. um, you would have the okay to go ahead and administer oral glucose to that patient who is presenting again with confirmed low blood sugar and who is a diabetic. And then the blood sugar that is low on them has to be less than 60 milligrams per deciliter of blood.
Um, and what is the normal range of a blood glucose level?
Typically, a patient, like I said before, less than 60 is considered low for patients who are considered hypoglycemic, and then above 150 is considered hyperglycemic. But where they start getting into really kind of, I guess, more dangerous waters is anywhere from 250 to 500 is when they start getting into chance of going into diabetic ketoacidosis. But in those ranges is less than 60 would be concerned, and then above 150 to maybe 250 and above would be a concern for a patient being hyperglycemic.
And how would you know when to administer hypoglycemia? Like, what are the signs and symptoms?
So, some of the signs and symptoms of a patient who is presenting as hypoglycemic, again, to administer oral glucose, is a couple of things. One of them being skin signs. Skin signs will tell you a lot about a patient. A patient who is a confirmed diabetic presenting to you with certain skin signs will again tell you a lot. So there's a little rhyme that they have for patients. It's cool, clammy, need some candy. Hot, dry, sugar's too high. So basically, what that means is that if the patient is presenting as pale, cool temperature wise, and then clammy meaning diaphoretic, then chances are their blood sugar is pretty low and that they need some sugar. Hot, dry, meaning that again temperature and then the moisture content of their skin, it being dry, not moist. Sugar's too high, meaning that their blood sugar is probably too high. So as pertaining to just what we're talking about with administering oral glucose, if they're presenting as they're really diaphoretic, they kind of lost some color, they look a little pale, they are a confirmed diabetic, then they may have low blood sugar and you may be okay to go ahead and administer oral glucose. Another way to go ahead and to determine if they are hypoglycemic is one using a glucometer and checking their blood sugar. So again, if their blood sugar reads less than 60, then they are considered hypoglycemic, and you are allowed to administer oral glucose. But that's with using a actual glucometer to check their blood levels.
And are there any contraindications in administering blood glucose or oral
Yes.
glucose?
Yes, there actually is. So, if one thing to keep in mind when administering oral glucose. So again, I kind of skipped one of the signs though too. So if somebody is hypoglycemic, they tend to present as altered. So that's one thing that kind of goes in with people or patients are that you get called to that are confused. They have an altered mental status. They may even come across as being combative. These are all signs that can be presented with somebody who has low blood sugar. And although there are many other reasons that can be um, associated with people who are altered, having low blood sugar is a really, really big thing with that. And so a patient who is altered past the point or even lethargic past the point of being able to take anything orally, again, because this is a pace, is something that's going to go ahead, basically be administered to the patient orally. A contraindication to that is somebody being so lethargic or so confused to the point that they may possibly choke on the medication that you're giving them. That presents another hazard. So that's a situation where you wouldn't want to administer that medication. And there's other routes of getting their blood sugar up, whether it's through IV administering dextrose to them. But that's one indication that's actually pretty big. If they're very altered, you want to hold off on giving them any sort of medications per via mouth.
So, what are the national protocols and local protocols of administering glucose?
So the national protocols when it comes to administering oral glucose are very pretty pretty vague. It basically what it tells you is that you could administer oral glucose under medical direction. Again, whether that's under standing orders, depending on where you work at, standing orders or actual evaluation of either ALS being on scene or en route. Um, and then again, confirmed diabetic patient and confirmed low blood sugar levels, meaning that you've checked their blood sugar and their blood sugar is reading less than 60. So those, as far as the national, those are some of the guidelines of what you want to go by for being able to utilize that skill. As far as when it comes to local protocol for just Orange County, according to OC Meds, it's pretty much pretty similar to what the national is. The only thing that they require of the BLS levels, just straight EMTs, is just that you have ALS either on scene, supervising or overseeing the procedures being done, or they are at least en route and are obviously aware of what's going on. So, as far as just local protocols, that's one thing that's very big here is that they want ALS to be involved in that decision making as far as checking blood sugar before you even do that, and then before administering oral glucose, because obviously you have to administer oral glucose, you have to know what their blood sugar is to know that it's less than 60 in order to administer the medication. So before any of those steps happen, ALS has to either be on scene supervising or at least en route to the scene, and before you can go ahead and go about it that way. So those are some of the protocols of what you have to kind of just go by as far as when it comes to national protocol and local protocol.
So, as a brand new EMT, what are the steps of the process of administering oral glucose? And um, would you be able to kind of run the scene for me?
Yeah, absolutely. So, uh, well, from getting dispatched to the scene, then you get on scene, and then you are able to be there with your patient, go through your medical assessment, and you come across seeing that okay, your patient's altered. Initially, you were called out of some sort of diabetic call. Um, One being able to tell again your patient may be altered that you're not able to get that much information from them, but if they are cooperative and you're able to get a little bit more information from them as far as like being able to get a blood sugar reading using your glucometer. Again, at this point, using a glucometer, you are also have either ALS on scene with you or they are confirmed en route and you're coming to your location, your direction, so you have the okay according to OC Med's protocol. You have that okay. Using a glucometer, being able to get their blood sugar, if it's reading below 60, then you have a very solid reason or confirmation that their blood sugar is low. They're probably diabetic. They're presenting as being confused, and that gives you the okay. As long as they're not too altered, too lethargic, that will go ahead and give you a reason to administer oral glucose and to order to bump up their blood sugar. So after getting the blood sugar reading, it presenting as less than 60, then you go ahead and take the next step to go ahead and administer oral glucose as long as they can take it, per mouth, and you don't have any fear of them choking on it or anything like that. They're pretty compliant. They're just altered. The tube that you can get, which I will put a picture right here, is what it looks like. And that tube, basically, you go ahead and open it up. You're going to want to give that to them orally, so it's going to go into their mouth, and you want to go ahead and give them the entire tube. You don't want to just give them half or anything like that. Just go ahead and squeeze the entire tube into their mouth. Again, being cautious, don't just squeeze it all at one time. Allow them to be able to kind of, just break it down and swallow it and then give them more when they need it. But you want to make sure that they take that entire tube, and after they do that as well, it's also just making sure that you also recheck blood sugar as well. And then documenting everything that you do, that you check their blood sugar, what time you checked it at, what you gave them, obviously oral glucose, at what time you gave it to them, and then reassessing as well. Reassessing is also a big thing, and then what was their blood sugar after you administered it. So those are kind of like the steps that you'd want to go ahead and make sure that you take when administering oral glucose. And that's pretty much the process of just that skill that you can do as an EMT, as well as you. And any other questions on oral glucose or diabetic emergencies or anything?
No, I think that answered them all. Excellent.
Okay, awesome. Well, that was our video. I hope you enjoyed it. Thank you for allowing us to share this time with you guys, and I hope you guys got something out of it. I know I did, and we'll see you guys next time. Also, here is the works cited of where I got this information for the protocol, so you can look that up. Again, it'll be displayed right here, and if you guys want to look that stuff up for yourself, it'll be right there in the link. Thank you, and bye-bye.